Washington State residents enjoy some of the most beautiful surroundings in the world. And life on the Kitsap Peninsula is a treasure to those who make their homes here. We treasure our forest lands, our parks, and our nature preserves. We treasure our communities. We treasure our families. And we treasure our health. Nathan Schlicher also cares about your health. Nathan is running for state senator in the 26th Legislative District. He is an emergency room doctor at St. Joseph's Medical Center, and in fact the only doctor in the state legislature. Your health and the health of your loved ones is a fundamental right. Nathan Schlicher believes that we are all entitled to accessible and affordable health care. But as poverty rates have risen, families across America have fallen further from accessible, affordable health care. Further cutbacks to cash assistance programs for very low-income families has contributed to these rising rates. Nathan Schlicher is a leading advocate for affordable and accessible health care, especially for Washington's children, the disabled, the poor, and the elderly. Nathan Schlicher successfully advocated for the ER for Emergencies program that has replaced the state's plan to deny emergency room services to Medicaid patients. This effort will yield $31 million in savings annually by making better health care for Medicaid recipients. Nathan Schlicher has also advocated at the federal level for affordable health care. And while Nathan acknowledges that the Affordable Care Act is not perfect, he believes that with a commitment to affordable and accessible care, we can continue to work towards universal access. Nathan Schlicher's opponent, Jan Angel, has countered these efforts by sponsoring legislation that would have eliminated coverage for mammograms for women under the age of 40 and also immigrant women, affecting thousands of Washington women. Jan Angel has been consistent in her opposition to the Affordable Care Act and has sponsored legislation to inhibit its implementation here in Washington State. 14% of Washington State citizens have no health insurance. This is nearly 1 million state residents, which includes over 100,000 children. While Jan Angel has opposed efforts to increase access to and affordability of health insurance, she has never offered alternative legislation that would meet the health care needs of her constituents. Nathan Schlicher has sponsored or supported multiple bills seeking improvements in health care delivery. These include community mental health service improvements, the prescription monitoring program, which would improve patient safety and reduce drug errors, thereby reducing Medicaid costs and incidents of Medicaid fraud. Nathan has advocated for the introduction of CPR classroom trainings in high schools. He has sought updates to hospital health care associated infection rate reporting. And the expansion of the ER is for Emergencies program. And Nathan has also introduced preliminary legislation aimed at curtailing costs of the diabetes epidemic in Washington state. Nathan Schlicher's opponent, Jan Angel, has sought to limit standards of care and benefits for Washington families, including coverage for mammograms, diabetes, autism screening, and maternity care. Jan Angel continues to promote the privatization of Social Security. Jan Angel has voted to block and defund health insurance initiatives in Washington state. She's also opposed the Reproductive Parity Act. A look at Jan Angel's campaign contributors includes for-profit health insurance and pharmaceutical companies. We would ask you to consider, what is their investment in our families, our health, and our future?